How do you safely use ear irrigation to clean your ears? Ear irrigation can be an effective way to remove impacted earwax when it causes symptoms like hearing loss, ringing, dizziness, or discomfort. But it's important to know that it should only be done when necessary and under proper guidance. The goal is to protect your ear health and avoid injury. First, remember that ear irrigation is not a routine cleaning method. It is only appropriate if you have symptoms caused by excess earwax. If you have no symptoms, there is usually no need to remove earwax. When symptoms like muffled hearing or earache appear, consult a healthcare professional to determine if irrigation is suitable. Certain conditions make ear irrigation unsafe. Do not attempt it if you have a perforated eardrum or a history of ear surgery unless your doctor says otherwise. If you recently had an ear infection or have swimmer's ear, avoid irrigation until your healthcare provider clears you. Also, if you have ear tubes, inner ear problems, or are immunocompromised, it's best to seek professional advice. Never irrigate the ear with a ruptured eardrum or if you have a history of ear complications. Before any procedure, a healthcare provider will examine your ear with an otoscope to check the ear canal and confirm the eardrum is intact. They will review your medical history and explain the risks involved. Always follow their instructions and get their approval before proceeding. When performing ear irrigation, sit upright or lean your head slightly to the side. Place a basin or basin-shaped towel under your ear to catch water. The outer ear should be cleaned gently with a damp cloth beforehand. Use a sterile syringe or bulb with about 20 milliliters of warm sterile water or saline. Tap water should be avoided because it can sometimes cause infections. The water temperature must be close to body temperature, between 98.6 and 100 for 0.9 degrees Fahrenheit, to prevent dizziness or discomfort. Direct the water stream along the roof of the ear canal, aiming slightly upward and backward. Never aim the stream directly at the eardrum. Gentle, steady pressure is key. Do not use more than 500 milliliters of solution per ear to reduce risks. If you feel any pain, pressure, or discomfort, stop immediately. The procedure should never cause pain, and if it does, it needs to be halted. Throughout the process, monitor for any signs of adverse reactions like sudden pain, ringing, dizziness, or nausea. If any of these occur, stop the irrigation and have your ear examined. If the eardrum appears ruptured after irrigation, seek medical attention promptly. You might need antibiotics or further evaluation from an ear, nose, and throat specialist. After irrigation, gently dry the ear with a towel or use a few drops of alcohol to help evaporate residual moisture. Sometimes multiple sessions are needed, but if earwax remains after 5 attempts, discuss alternative removal methods with your healthcare provider. These might include manual removal with special instruments or softening agents. If home irrigation is unsuccessful or you have any contraindications, it's safest to see a healthcare professional. They can perform the procedure safely or suggest other options. Remember, addressing earwax buildup promptly can prevent temporary hearing loss and help maintain your ear health. Always prioritize professional guidance to ensure your ears stay healthy and safe.